Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words. And for some of them, the cause was never their age. It was a bottle sitting on the bathroom shelf that they were promised was safe. I am Dr. John Myers. 15 years of practice, and I have watched this exact picture play out more times than I can count. Someone sharp their whole life starts losing the thread. Names, appointments, the drive at home they have made 1,000 times, and everyone around them calls it getting old. It wasn't. It was a medication. One almost nobody thinks to question because a doctor prescribed it and a pharmacy filled it. Here is what the newer research keeps showing. One ordinary everyday class of drug can pull your memory and your learning down hard inside a single year, and most people taking it have no idea it is happening. Today, I am walking you through the 9 medications most closely tied to rapid memory loss. Count it down from the ones that get quietly overlooked to the one I consider the most destructive of all. Watch for number 3. It is handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without a single warning sign. Before we start, tell me in the comments how old are you and which medications do you take every day? I read them, and the age of this audience shapes what I cover next. Let's start at number 9, and don't let the low spot on the list fool you because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, to take the edge off a cold. It costs a few dollars, it sits on an open shelf, and most people assume that because nobody needs a prescription for it, it must be gentle. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word for a simple idea. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and to stay alert through the day. As we age, the brain makes less of it and leans harder on every bit it has left. So a drug that blocks it lands far heavier on a 70-year-old brain than a 30-year-old one. The part that takes the hit is the hippocampus, the small seahorse-shaped structure where new memories are formed before they get filed away. In my practice, I have watched patients take a nightly antihistamine for years and slowly lose their edge and never once connect the fog to the pink pill by the bed. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half again the normal risk from something most of us treat like candy. Here's what to do. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine sold as Claritin that do not cross into the brain the way Benadryl does and are far safer for the long haul. Never stop a medication on your own. Bring it to your doctor. But stop assuming that over-the-counter means safe for your memory. That is number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The big names are omeprazole sold as Prilosec and esomeprazole sold as Nexium. These shut down acid production in the stomach and they get handed out for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back. So it feels like the drug is the only thing holding the line. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food, and chief among them is B12, which protects the wiring of your nerves in your brain. Turn the acid down far enough, long enough, and your B12 quietly drops. So do magnesium and calcium, 2 minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutrient your medication has been blocking all along. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia than people who did not take them. And the trouble runs deeper than nutrients because PPIs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. So here's the move. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine sold as Pepcid, which is far less likely to touch your thinking. Chewing deglycyrrhizinated licorice, a natural compound that coats and calms the stomach lining, can ease symptoms with no cost to the brain at all. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Ditropan. It is given to seniors who deal with a sudden urgent need to get to the bathroom, the kind of overactive bladder that can reshape a whole day. The relief is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks. And this one slips across into the brain very easily and parts itself right where memories are made. That makes it one of the more dangerous ones on this list for an older adult, especially taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And here is what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation, and everyone around them nods and says, "Well, you're getting older." It is rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you have noticed your memory slipping, take that seriously because you do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Mirabetrix, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they give the same control with far less risk to thinking. Bring it up at your next visit. Number 6 might be the most surprising one here because it is one of the most prescribed drugs on earth. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the world, especially after 60, and they do an important job lowering cholesterol and cutting the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and this is not a case against them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every nerve so signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. The statins that cause the most trouble are the ones that cross easily into brain tissue. In 2023, a study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the slide. Some patients described frightening blanks, a familiar name gone, a conversation they just finished erased, a route they had driven for 20 years suddenly unfamiliar. The important thing to understand is that not every statin touches the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily and are generally considered the safer choices for thinking. So, if you have been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly quit a drug that may be protecting your heart. Get the plan right with help, never on your own. Quick pause. If this is connecting the dots for you, take 1 second and tap that like button. It genuinely helps this reach more seniors who need to hear it. And while you are down there, tell me how many prescriptions you are taking right now. I read every comment. All right, back to the countdown. Number 5. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most prescribed drugs in America for anxiety and for sleep. And they work by boosting GABA, the brain's own calming signal that turns down a racing, overstimulated nervous system. At first, they feel like a rescue. The panic eases, the spinning thoughts stop, sleep finally comes. Over time, the picture changes. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer-acting ones like diazepam were worse because they linger in the body and build up in fatty tissue, including the brain. What the drug is doing is a slow chemical sedation of the whole brain. It learns new things more slowly, it grows less flexible. And many people describe a flatness, a sense of moving through fog, of not quite being themselves anymore. The cruelest part is the exit. Stop a benzodiazepine abruptly, and the anxiety and insomnia come back twice as hard, along with agitation that can be genuinely dangerous, which makes the pill feel essential right when it is doing the most harm. So here is the rule, and it matters. If you have been on a benzodiazepine for more than a few weeks, do not stop suddenly because that can be life-threatening. Work with a doctor to taper down slowly over weeks or months. Gentler options exist like buspirone for anxiety, which does not sedate or cloud the mind, and a form of talk therapy built specifically for insomnia and anxiety that brings the calm back without the cognitive cost. Number 4 is a single pill prescribed for 3 different problems, and it carries one of the heaviest hidden burdens of all. Number 4 is amitriptyline, sold as Elavil. It is an older antidepressant that is still handed out today for nerve pain, for sleep, even to head off migraines, and that versatility is exactly why it spreads so quietly. It looks like a do-everything pill. Underneath it is one of the most powerful anticholinergic drugs still in wide use, which means it blocks acetylcholine hard, the very chemical your neurons need to talk to each other and lock in new memories. It blocks it so strongly that with long-term use, the effect on memory stops being a rare side effect and becomes the expected result. In 2015, a large study in JAMA Internal Medicine followed more than 3,400 adults aged 65 and up. Those with the highest cumulative dose of anticholinergic drugs like amitriptyline over 10 years had a 54% greater chance of dementia, and almost none of them were ever told the pill could do that. They got it for sleep or for pain, then slowly noticed words going missing, memory thinning, concentration fraying, and chalked it up to age. It does not even take a high dose. A small nightly dose taken for years can quietly erode brain power with no obvious symptom until the loss is real. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, options like duloxetine or gabapentin can give similar relief without the same anticholinergic weight. For sleep, melatonin or a very low dose of doxepin, which is far gentler on this chemical, can take its place. And for mood, newer antidepressants like sertraline or escitalopram are considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for because it is handed to millions for something that sounds harmless. Number 3 is paroxetine, sold as Paxil. It is one of the most prescribed of a family of antidepressants called SSRIs, used for depression and anxiety. And on the surface, it looks like the modern gentle option, kinder than the old psychiatric drugs. Here's the detail they rarely mention. Paroxetine is the one SSRI with strong anticholinergic activity. That single fact sets it apart from its siblings like sertraline and escitalopram because it reaches into the same acetylcholine system every other drug on this list has been chipping away at. In 2021, a large review in Frontiers in Psychiatry looked at older adults on different SSRIs and found that paroxetine users showed measurable drops in short-term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. There is a hard irony in that because the drug is given to steady the mind, and over time, it can wear down the very clarity it was meant to protect. The fix here is clear. In older adults, paroxetine is one to avoid. The American Geriatric Society placed it on something called the Beers List, a formal catalog of drugs considered risky for seniors, and paroxetine is on it for exactly these reasons. If you take it, ask your doctor about moving to a safer SSRI like sertraline or escitalopram, which are gentler and do not carry the same cognitive risk. Supporting your B vitamins, especially B12 and B6, can help steady mood naturally alongside that change. Number 2 is so quietly prescribed that many people taking it have no idea what kind of drug it even is. Number 2 is the antipsychotics. And this one disturbs me the most because so many people taking them never agreed to take an antipsychotic. The names are quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. They were built and approved for serious psychiatric illness like schizophrenia and bipolar disorder. Today, they get handed out off-label to older adults for sleep, for mild restlessness, for the agitation that can come with dementia itself. Powerful drugs meant for severe illness now used in homes and nursing facilities on seniors who are simply confused, restless, or hard for a busy staff to manage. The cost is steep. In 2022, a study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within a year, even with no history of dementia before they started. These same drugs also raise the risk of stroke, of sudden cardiac death, and of the heavy sedation that leads to falls and hospital stays. They work by suppressing dopamine, a chemical tied not only to mood, but to focus, planning, and memory. Drop dopamine far enough and the brain goes slow and unresponsive, which is why people on these drugs can seem dull, flat, almost absent, while their families grieve someone who is still sitting right in front of them. If you or a loved one is on one of these, the first move is to ask the prescribing doctor a direct question. Why was this started, and is it truly necessary, or is it here for convenience? Most behavioral symptoms can be eased without a drug at all through steady daily routines, less noise and overstimulation, treating hidden pain, and fixing light and sleep. When medication really is needed, the lowest dose for the shortest time keeps the harm down. Far too often, no one ever tells the family what these drugs do to the brain, and they watch a decline they believe is aging when the cause is chemical. Number one is not a single drug at all, and it may be the biggest hidden driver of every story I just told you. Number one is anticholinergic polypharmacy. It is the danger almost nobody names, and it may be one of the largest causes of drug-induced memory loss in older adults. You were probably waiting for one final villain, a single worst pill. The real worst case is something subtler. The slow stacking effect of taking several anticholinergic drugs at the same time with nobody adding up the total. Polypharmacy simply means many medications at once, and anticholinergic burden is the combined weight of all of them blocking that one memory chemical together. Picture a very common situation. A senior takes Benadryl every night to sleep, oxybutynin every day for the bladder, and amitriptyline for nerve pain. On its own, each one might cause only a small, barely noticeable dip. Taken together, they compound, and the total burden on the brain climbs fast. In 2022, a study in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double. And the great majority had no idea they were on anticholinergic drugs at all. No one had ever explained it to them. When you block acetylcholine from several directions at once, the brain does not just idle. Neurons start to wither from disuse, connections shrink, and the brain settles into a quiet, underpowered state that looks almost identical to Alzheimer's on testing. Here is the hopeful part, and it is the reason I made this video. Drug-induced decline is often reversible when it is caught early. Lift the burden and many people get their clarity, their energy, and their memory back within weeks or months. The brain is more resilient than we give it credit for, but only if you take away what is hurting it. The fix does not take a miracle. It takes a careful medication review. Sit down with your doctor or your pharmacist and have them go through every prescription, every over-the-counter pill, and every supplement and add up the anticholinergic load. There are simple scoring tools that do exactly that. Once the problem drugs are spotted, you can taper off what you do not need, switch to safer options, and give the brain room to recover. This is the most preventable threat to the aging mind on this entire list, and that is exactly why it sits at number one. Now I want to hear from you. Of these 9, which ones are in your cabinet right now? Have you noticed brain fog or forgetfulness creep in after starting something new? Tell me below, and tell me you will ask for a medication review this week. Your answer might be the thing that saves the next person who reads it. And before you go, there is one more place your body hides its warnings. Your medicine cabinet is one, your hands are another. Your fingernails can flag trouble in your kidneys, your blood, even your nervous system years before anything else does. And most people never know what to look for. That is the next video. I will show you the 4 nail signs worth checking tonight. I am Dr. John Myers. Stay sharp, and I will see you there.